Good evening. Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and this video is a continuation on our series on hyperlipidemia and cholesterol. So this is cholesterol, important history, and exam findings. I decided to go ahead and combine history and exam for this just because I think we can probably cover both in one video. Because there's not a whole lot to find on history and exam with hyperlipidemia. And the reason being is that it's more or less a silent phenomenon. So most people, by far and away, most people who have high levels of cholesterol don't have any symptoms because of that, and they don't have any changes in their exam because of that. Now, especially as you get into really high levels, you certainly can get to where you're seeing some different things that we'll talk about here in a minute. But for kind of standard hyperlipidemia, you can be having high enough cholesterol that you're damaging the vasculature and you're having risk of problems in the future, but not have any symptoms and not have any exam findings. So as far as history, important history when you're dealing with hyperlipidemia, mostly it's to do with family history, as far as any family history of high cholesterol, early heart attacks, early heart disease, things that might cue you into the fact that there's a cholesterol problem. And then if someone's already known to have hyperlipidemia, you have someone, they already have high cholesterol, they're on a statin medication or other treatment, and they're following up, then really the history is a matter of monitoring compliance. Do you take your medicine every day? Do you have any problems taking it? Does it cause any side effects? Those types of things. And so there are a number of people who have familial hyperlipidemic syndromes who have cholesterol that's through the roof and would not know that they had that unless they get blood tested. It's one of those things that there's reason to screen for lipids in just about anybody at least once, because there's no good way of knowing if someone has really high cholesterol or not other than doing a lab test and finding out what their numbers are. So history mostly is going to focus around those types of things. Like I said, so family history of early heart problems, heart attacks or heart disease, or high cholesterol. And then if they're already on medication, then the history is going to focus mostly around what are you taking, how often do you take it, are there any problems, are there any side effects. So those are really your main history questions that you're looking at as far as dealing with someone with high cholesterol. Exam is similarly simple for hyperlipidemia. So very few findings. If you get really high cholesterol, you can get the white spots kind of around the eyebrows and around the eyes and on the face, the xanthomas, which are just little actual cholesterol deposits in the skin. And so that can happen in people with really high cholesterol. That being said, there are people who have sky high cholesterol who do not have those, and people who have those who have not that high of cholesterol. So it's one of those things that is an interesting finding. If you see it, if you see someone, a new patient or someone, and they have those kind of deposits, white deposits around their eyes and things, and even sometimes on their arms, they can get this. Certainly something to look at and say, oh wow, we need to check your cholesterol. Those might be cholesterol deposits rather than some other rash or other pathology. So that's possible. Besides that, there's not a whole lot of different findings that come along with having high cholesterol. As the disease advances, you might find things that are characteristic of vascular disease. So if someone's had high cholesterol for many, many years, then what happens is that they get blockages, and so venous stasis could be a complication of having had high cholesterol for a long time. Erectile dysfunction could be a complication of high cholesterol for a long time. So there's end organ type of things that could happen that could have resulted from high cholesterol. But direct physical exam findings where it's like you're just doing an exam and you see something that makes you think they have high cholesterol, really there's the xanthomas that can appear, and that's just about it as far as I know, as far as common physical exam findings. So important exam when you're monitoring and managing someone with high cholesterol is really cardiovascular exam. So you want to be listening to the heart and checking the pulses and making sure that there's good circulation and good cardiovascular function. So those are the important things to examine. Some of the things that you can see with cholesterol when it's high and then the history elements as far as making sure there's not a family history of problems, and then checking for compliance on medications and side effects and issues like that. And so pretty straightforward. Cholesterol, it's pretty rare you have a patient that is just seeing you for cholesterol. Usually it comes along with diabetes, it comes along with hypertension, it comes along with other comorbidities, and so it kind of gets combined with other things. But if you did have just a patient whose only pathology, only problem was that of high cholesterol, then you certainly could have that simple of a history as far as managing that and taking care of it. So I hope that's helpful and that you have a great night.